Good afternoon, good morning. We are here today. The topic of my presentation is, let me get back to my notes, healthy spine, healthy body, alternative approaches to maintaining the health of the neck and the back. So I'll make a few assumptions. If you're here for that title, I'm going to assume that you have some questions or concerns or just some kind of interest in the health of the spine. Maybe you might even have specific diagnoses or conditions that you're wondering about. So if that's the case, please let me know. If I touch on anything in the next 20, 25 minutes that you'd like some more elaboration on, that would be great. I'd love to hear it. So just raise your hand and interrupt me. These work a lot better if it's more of a dialogue and less of a lecture. I've done enough of them to know that if we're having a conversation, you're going to get a lot more out of it. So I'll try to make it as interesting as I can. I think this information is really interesting. This is what I do all day long, but I'm biased. So if there's something that you'd want to hear more about, please let me know. A little information about me. My name is Doug Gordon. I'm a chiropractor. I work here in Battle Creek. I've got a practice on Beckley Road, and it's Mingus Creek Chiropractic. I've been practicing in Battle Creek for almost 10 years, and I've been a licensed chiropractor since 2004. Love what I do. We get a chance to really make an impact on a lot of people, whether it's recovering from injuries, maintaining the health of the spine, helping them achieve some pretty important goals, and just making sure that they're working in gravity the best way that they can. I live in Kalamazoo. I've got a wife, 3 kids, super busy. I've got a lot of interest, whether it's golf or travel, yoga, bike riding, a few different things too. But that's me, and I'm happy to be here. Thanks for having me. Please, if you have more questions or anything going on, please let me know, raise your hand or interrupt me, and we'll get rolling. I do have my notes on a little drive here, so I'm going to be referring to this. I'm not checking my Twitter feed or anything. So let's talk first about the why, the what, and then the how. So the why are we here? Why is it important to discuss the health of the spine? You don't have a lot of lunch and learns about the health of the big toe, for instance. Whereas the anatomy might be the same. It might be a bone here and a bone here, and then a collection of connective tissue around it. The health of the big toe isn't nearly as crucial as to the health of the spine. So why is that? Why is that the case? The health of the spine is really a major factor of other health issues, and we'll get to those in a second. We'll also talk about the what. So what factors affect the health of the spine? And then at the end, more towards the end, we'll talk about how. So how can you keep your spine as healthy as possible? And part of the topic here is alternative approaches. So I'll touch on some of the medical approaches that are available. But I'm assuming if you're here for the alternative approaches, we're going to focus more on that, whether it's chiropractic, exercise on your own, nutrition, anything that you can do that's more holistic, a little more self-directed perhaps, and things that are often much more effective. So we'll touch on any of those that you're interested in as well. So we'll discuss the why of this and the what and then the how. So why is the health of the spine important? First and foremost, why do people come see me? Because they might be in pain. And if the spine's not functioning well, there's often some kind of dysfunction, there's some kind of pain. And that pain can come in a lot of little different flavors. It can be from a headache, a migraine, it can be neck issues, it can be rib misalignments in the spine, it could be lower back problems, sciatica, numbness and tingling, loss of sensation. All of those symptoms are often attributed to some kind of dysfunction in the back. And there's different causes for that, whether it's a pinched nerve, herniated disc, old whiplash injuries, sporting injuries, postural issues, ergonomic trouble. All of those factors play a role. So when you have that pain, obviously you may have some sort of dysfunction. You're not going to be able to do what you want to do, whether it's take your dog for a walk, play around a golf, whatever it might be. That dysfunction then often is the reason why someone might come see me, is because they've had some issues, they've had some symptoms, and now those symptoms are getting in the way of what they want to do. Oftentimes there is an overt injury, like I had a whiplash, I had a slip and fall, but most often I don't know what happened. This has been getting worse for a few months. and now it's out of control, and I can't take care of it anymore, and there's something that's limiting my body's ability to heal. So what we have to do is assess that and then find out how we can impact that area of the body so that then the body can heal itself the way it's supposed to. Then the third factor in the why of why the spinal column is important to the health is the nerves that leave the spine don't just tell the brain that there's something that's painful or that there's no sensation or less sensation. Those nerves contribute to the health of a lot of other systems in the body. So I'm going to do a really poor job of drawing here, so please forgive me. This individual, there's his head, he's looking that way. And here's his neck. He's got a curve in the neck there. Got a curve in the mid-back, and then a curve in the spine, and then there's the pelvis, and then we got the legs, okay? So if we were to focus in on like this area here, okay, and zoom in, we'd have a bone with another bone, and then your intervertebral disc, which is the shock absorber of the spine, okay? And we'll get to the anatomy of that in a second. And then between this area, there's another portion of the bone that goes outward here and there, and we can feel these portions when you feel down your spine. That's this spot right here, okay? So the actual bony part that you can feel in your back is called the spinous process. That is only a very small portion of the vertebra itself, okay? Here are the big blocks of the bones. These are the structural components that provide the axial weight of the spine. The reason the spine's so important, and the reason it's different from the big toe, is because of this area here is where the spinal nerve leaves the spinal column and it travels somewhere. Okay, the nerve splits off, part of the nerve goes to a muscle, skin, an organ system, whatever it is. And now we're talking about 28 some odd segments all the way down the spine, left and right. Nerves are exiting and entering the spinal column and communicating with the brain somehow. That's why the spine's important. Anatomically, these joints protect the nerves, and their ability to communicate with the brain can be compromised if this joint doesn't work the way it's supposed to. So that's part of the why. So the reason why someone with a neck issue, for instance, might have some neck pain. They might also have some headaches because these nerves go up in the head. Well, maybe this person's also getting fatigued all the time because those nerves go into part of the organs responsible for our metabolism. Maybe they don't sleep very well, again, because their metabolism's off. Maybe these nerves going into the immune system don't function the way they're supposed to. So someone with neck issues gets sick more often. They're getting a cold every other month as opposed to once a year. Those are all things that I see every day in our office. There's a connection between the health of the spine and the health of the organs. Other comparisons to that, let's say in the mid-back, someone in the mid-back, if they've got a lot of rib misalignments, they'll get that spot between the shoulder blades they just can't quite fix, and it's always giving them trouble. Those nerves also go into the muscles of the shoulder. They might go down the arm. Perhaps they go into the upper digestive tract. So people with a lot of mid-back issues, they come in there, and I ask them, do you have any other digestive issues? And they'll almost, not always, but a good portion of them will say, I get heartburn all the time. Well, their heartburn is often a part of the dysfunction in the spine. Now, this is an important thing I want to point out. This is where chiropractors get a bad name, honestly. Some chiropractors, you might have heard of other chiropractors who say, we can cure the common cold, or we treat ear infections, or something like that. It's not that an adjustment or any kind of chiropractic care is going to cure those conditions. So no adjustments in the mid-back is going to cure heartburn. However, if you have misalignments in the mid-back, some kind of dysfunction that's irritating the nerves that go into the upper digestive tract, well, now the stomach isn't going to work as efficiently as it normally should. Now it's more susceptible to heartburn. Okay? You're less resilient in those systems. So making sure the spine is functioning the right way is a really good way to make sure you're getting the most out of the neurological component to whatever organ you're trying to help. Another example of that is in the lower back. So the lower back will often see a lot, sciatica. These nerves leaving the lower spine go right down the leg. They go into the muscles around the torso. They also dive into the pelvis. Someone with lower back issues might also have some digestive issues. Maybe they might have problems with their reproductive organs. Maybe they might get irritable bowel syndrome, which is so common, And plenty of those issues are really helped if you make sure the low back is functioning the right way. And again, it's not that someone with irritable bowel syndrome will say, well, I'm going to treat your IBS. Instead, we say, well, if you have irritable bowel syndrome, you want to make sure the spine's functioning better so that those organs have everything they need neurologically. And then let's also talk about what's your nutrition like, what's your food like, things like that. So that's the why. Someone comes in with a spinal complaint, it's important to them because they're getting some sort of symptom, some sort of problem, they're having some sort of dysfunction in the spine, and then they're also, maybe, not all the time, sometimes you're allowed to have just a neck issue and maybe you don't get sick more often, maybe you sleep fine. So it's not every patient, but it's common enough that there's a pattern and it makes sense anatomically. But oftentimes there's some other kind of component there. Any questions on that part of it? Sense? Good deal. Okay, so let's move into the what now. So what are the causes of, some of the factors that might cause these dysfunction? Okay, how might you have a problem in this? Well, the first and foremost reason is gravity. If you're talking about the spine, it's always under gravitational force. And again, that's another reason why the spine is more unique than the body. It's different than the wrist. It's different than the shoulder, where there's not as much gravitational pressure going through these joints. But our spine is designed to withstand this axial pressure from living in gravity all the time. But if you live in gravity long enough, you're going to have some kind of deterioration in the spine. There's going to be some arthritis at some point. If you're over the age of 40, you've got it already. It might be very minuscule, but it's there. The spine does start to wear out just because we live in gravity and there's no way to get out of that. However, some things can accelerate the gravitational stress if you sit for too long throughout the day. If you've had injuries, whether it's old whiplash injuries, old sporting accidents. Obviously, a good population of the patients I see are current vets, active vets. They've had specific injuries related to extra pressure through the spine over a period of years. So those all contribute to the health there. Other than gravity, posture is a big part of this. Because if you maintain the right kind of posture in the spine, if we maintain the ideal, or as close to ideal as you can be, position of the neck, the mid-back, the lower back, the hips, you're not going to be exacerbating any conditions that might be there. And there's ways to help with the posture, and we're going to get to that too. And then primarily the other part of the what causes this are subtle changes in the alignment of these vertebrae, and that's where chiropractors come in. We analyze the spine in a way where we can say, okay, well, this joint is supposed to be moving in this way, and it's not. Well, why might that be the case? Maybe they've had the injuries, maybe they have the poor posture. So let's make sure we can restore some of the normal movement in the spine so that this joint can function better. Now, here's another misconception about what chiropractors might do. I'm not going to move a bone from position A to position B. We don't do that. It's not as though an adjustment or any kind of chiropractic treatment actually changes the position of a bone, where if I took an x-ray before a treatment and I took an x-ray after a treatment, it's ever going to look different. That's not what we do. Instead, chiropractors take the alignment that's there and we help with its movement. So again, let's use that big toe analogy. You want that toe to move and flex and move in a certain alignment. Same thing for the spine. If you lose that movement and all of a sudden there's not as much functioning there, well, now that nerve is more likely to get irritated. So with healthier movement comes healthier functioning, and that's really where chiropractors come in. So our job is, at least my job, is always to make sure we have better movement and then facilitate the body's naturally ability to heal. So so now let's get into the one other factor in the what might cause dysfunction in the spine. And this is something that I don't think nearly enough people consider. How is the body's response to an injury to this joint different? Why might we see more inflammation in a joint compared to another person who might have the same posture, similar history, and similar injury, so to speak? Oftentimes there's a nutritional component to this. Okay? People are eating foods that promote inflammation in the body. People are eating foods that make it less likely for a joint to heal if it's been injured, or just for the nerves to function the way they're supposed to. And where we make the biggest impact individually, like if you want to take something home of things you can be doing on a regular basis to improve the health of the structure of the body, whether it's the spine or the knee or the hip or whatever it is, start focusing on your nutrition. And I'm not talking specifically about weight loss. Obviously, weight loss is a big issue because if you're carrying around too much weight and you're in a weight-bearing situation, that's going to put more stress on the spine. Weight's a part of it, but it's not just the weight, it's also how is your body reacting to stress. Is it causing more inflammation or is it more resilient to that? And there are specific nutritional plans that work way better in terms of keeping the inflammation low and having the right kind of functioning in the joint. And then there's other ways of eating that you definitely want to avoid. We'll get to those in a little bit, but there's no surprises. I'm not going to sit up here and say that, Hostess is a great way to treat, an intervertebral disc issue, something like that. So now let's talk about the how. How can you, or what options are available for you to keep your spine healthy? First, we said we touch on it, the more medical approach, the kind of traditional models of dealing with an issue. And these are almost always symptom-based. Come in, I have pain here, how are we going to get rid of that pain? Take some pills, Advil, Aleve, ibuprofen, something to kind of cover up the symptoms, and then hope that the body can kind of resolve itself. That's one approach. Other approach is a little more heavy pharmaceutical, muscle relaxers, Vicodin. Let's just hit you over the head with something so you pass out for a day, and then when you wake up, maybe your pain's gone. Thankfully, that approach is going by the wayside because of the pretty significant problem with addiction to those meds. There are less prescriptions of those now, and they're going more of a how can we facilitate healing sort of approach. Physical therapy is a medical approach. They're going to focus more on rehabilitative kind of exercises, really important exercises, especially if there's been some deconditioning, if there has been injury, or if there just was a surgery, you want to rehabilitate in a certain way. So a good PT would be able to do that. And then I mentioned it, the surgery. So hopefully no one here has to go through or has gone through a surgical intervention in the spine. The patients that I see who have to have surgery, they'll try everything else before they make that choice. Because once you have the surgery done, whether it's a fusion of these joints, taking out a part or a whole part of the disc, you can never undo that. Sometimes they're necessary. Someone's just gotten to the point where they're not going to heal themselves, and they need to have a good neurosurgeon go in and clean things up. But you always want that to be the last approach. But we said we're here for more alternative kind of options. So what are the alternative options available to you? Well, chiropractic care. Let's touch on that real quick since I'm a chiropractor. I'm a little biased. Chiropractors, like I said, analyze the spine. We look at the alignment. Sometimes we do that with an x-ray. Sometimes we don't have to do an x-ray. It kind of depends on the patient. If I have a teenage athlete in the office, I may not always x-ray him. If I have someone who's in their 60s and they've had a couple accidents in their past and the doctor told them they've got arthritis in the spine, well, we'll probably get an updated x-ray to see what that looks like before we start any treatment. What the treatment involves for chiropractic care, and I touched on this, is let's make sure these joints are moving the right way. And there's a lot of ways that chiropractors can do that. There's different techniques that chiropractors use. We use our hands to adjust the spine. We can use a table. Certain movements in the table are helpful. There's devices that we carry around that are designed to make very specific adjustments. The point of any chiropractic adjustment is get the joint to move so it's healthier than it was before, and then that movement facilitates better healing so there's less stress on the nerve. And if you have a spinal issue, you got to find the right technique for you. And sometimes that involves going to a couple different chiropractors in order for you to figure out which technique is best for you. Anytime I heard someone say, well, I tried seeing a chiropractor, it didn't work, I always ask, well, what were they doing? Because that chiropractor's techniques might work really well for 80% of the patients they see, but it might not work well for the other 20%, and you got to shop around a little bit. And if I have a patient who's not receiving the benefit, we look at that too. We say, okay, well, what other techniques might you be able to use? Maybe I can't provide them, maybe a doctor down the street can. It's all about making sure you have the right technique for you. So that's what chiropractors do in a nutshell. Hey, let's make sure the nervous system is functioning the right way. We do that by making sure the spine is moving in as a healthy way as possible. And now the kind of technique I would do on you would be different than the kind of technique I do on you. It really depends on the patient and what they need and their history. So that's what chiroprators have to figure out. Other approaches. So what else can you be doing to keep the spine healthy? Let's talk about nutrition. And this could be a very long conversation, so I'll try to keep it as concise as I can. Very passionate about nutrition. Other than chiropractic, I talk about food more than anything else in our office because, as I mentioned, if someone really wants to make an impact on the health of their joints, if they start to look at the food they're eating and analyze that objectively and get some help on eating the right foods, they can make a really big impact. The processed, grain-based diet will cause more inflammation in the body. We know this. Been proven over and over again. More inflammation in the body is the cause of any major health concern. You're talking about heart disease, cancer, diabetes, Alzheimer's, strokes, whatever it is. It's all based on inflammation somewhere in the body. Arthritis, the itis means there's inflammation of the joints. That's what arthritis is. So depending on your nutrition, if you have that traditional American diet where you're eating a lot of grains and breads and cereals and pastas, you're going to have inflammation somewhere. And if you have joint problems, that inflammation will find itself to the joints. So the patients that we have who eliminate those grains and they start eating more of a paleo sort of diet where they are eating vegetables primarily for carbohydrates. They might have a little bit of fruit, but not too much because the fruit just turns right into sugar. You need carbs. Carbs get a bad rap sometimes. You got to have carbohydrates, but you got to get them from the right source. Carbohydrates from broccoli is different than the carbohydrates from a bagel. Not the same. It might look the same on MyFitnessPal. When you break it down, it's still carbohydrates, but it is a different kind of carbohydrate that your body responds differently to. So the carbs are important, but they should be in a balanced amount. We need healthy fats. You've got to have fat in your diet. Every cell in the body is composed of a cell wall, and that cell wall is made of fat. You need the fats in order for your body to function the right way. It's got to be the right kind of fat. So we want fats from avocados, coconut oil, olive oils. Animal fats are fine for the most part. You want to avoid those vegetable oils and things of that nature. We need fats. I've seen a lot of patients who are going on more of a keto diet, which is a pretty intense manner of eating, but it's almost entirely fat-based. And they have amazing results because they eat the right kind of fats. And they avoid any sugars at all whatsoever. And then, of course, there's protein. People hear of a paleo diet and they think, well, I got to eat raw meat. Or am I eating steak like all the time? And is that my only source of nutrients? It's not the case. But if you think about the course of mankind over millions and millions of years, primarily we came out of the cave and we had vegetables available. We had some fruits, nuts, and seeds, and we ate animal protein. So you need some sort of animal protein. Eggs, chicken, fish, turkey, beef, a nice variety of those. Notice I did not mention any bread, any grains, any cereals, any pastas, or any dairy. Dairy, for the most part, is way overdone. And patients we see who get rid of the dairy or significantly reduce the dairy, they see some pretty big benefits. And that can be a really tough point for a lot of people because we grew up on the Milk Does a Body Good campaign, and it's great marketing. And they sold a lot of milk doing that, but it doesn't necessarily mean that's the way we're supposed to eat. And studies show people who avoid those foods and focus on the paleo foods, they just have better health, particularly in the spine. If we're talking about spine, inflammation, healing ability, degeneration of the joints, if you want to make an impact on that, get the care you need, but also make sure you're eating the right foods. There's a ton of good resources on there. If you have a pen or a phone on you want to write down a guy named Robb Wolf, ROBBWOLF. He's a nutritionist. He's got a great website, got a great blog, great podcast. He's written a couple books on paleo diet. He's got searchable topics on anything from heart disease to weight loss to inflammation in the body, digestive issues, and really how he cues all the research on that and how that's helpful. So that's it on nutrition. That's my nugget and what I can tell you. And I know you've had guys like Brian Nessel coming in here. He's a nutritionist here in Battle Creek. Brian is fantastic. He's helped a lot of our patients make a lot of really important changes in their life, and that's primarily his approach. Is you got to pull back on anything that you see in the middle of the grocery store. Stick to the perimeter of the grocery store where all those foods are fresh. Stay out of the middle, and if you eat that way, you do pretty well. Any questions on the nutritional part? They, have tried to rewire pasta to, well, it's whole grain or whole wheat. It's still a grain, and the body doesn't react well to that. Yeah. Now, everybody loves some pasta once in a while. You love some pizza, on a Friday night with the family. I get that. And if those are your cheats, to do once a week or once or twice a month, that's fine. I understand that those things are enjoying life, but focusing on 99% of your nutrition coming from other sources, that's the way to go. Yeah. Other activities. Let's talk about more things you can be doing on your own, maybe some more active approaches to improving the health of the spine. We mentioned posture. I know you guys are going to have a little bit of ergonomic in a bit too. Improving your ergonomics at work, including avoiding the amount of time you spend sitting, is a huge aspect of improving the health of the spine. When you sit, there's 3 to 5 times at least more gravity going through, particularly your lower back, than when you stand. So anyone with a low back condition should be avoiding the seated posture for as much as possible. And maintaining proper core posture, stability in the pelvis, keeping the shoulders broad, the neck centered, all things a good chiropractor or yoga teacher can teach you. Those things are all super helpful as well. Specific activities you can do on your own. I really like the inversion tables. Anyone have an inversion table here? Anyone know what I'm talking about? Okay, so you've seen the tables where you kind of stand. It looks like one of those sit-up boards, but you're standing on it, and then you just raise your arms over your head and you start to flip upside down. What inversion tables do is they allow you to get out of gravity. And that was one of the first things I mentioned when I said, well, what is it that might cause strain to the joints in the body over time? Well, gravity is the one thing we can't get out of. But when you use an inversion table, you're essentially hanging upside down for a short period of time, and you're stretching the spaces between these vertebrae, a very subtle amount. And then you come back up into gravity, and then you go back down, stretch for a little while, and come back up. I have a lot of patients who are using inversion tables, and they get more out of the chiropractic care for sure. Because if they can stay out of gravity on a regular basis, my adjustments help them even more. It doesn't replace what we do, but it does help. Inversion tables, you can find them in any good sporting goods store, $300-400 tops. I was just at MC Sports the other day because they're going out of business, I think. And MC Sports had some really good tables for under $200. And if you have the space in your basement and you're going to use it every day or every other day, pick one up if you had some spinal issues. They're pretty helpful. Other forms of traction, there are cervical traction devices, so devices you can actually lay in, and they help stretch the neck. They help decompress these joints, these intervertebral disc spaces between the joints and the neck. Those are very helpful as well, but do not use a cervical traction device unless you've had a chiropractor say, okay, this is a good option for you. I would even say that if you're having some spinal issues, don't go out and buy an inversion table unless you talk to someone first and make sure that it's the right choice for you. Most of the inversion tables are going to be good for most people, but you want to make sure there's not something else going on there. But anything to get the joints out of gravity, so the inversion tables, the cervical traction, those work really well. As far as more active kind of things you can do, those are passive techniques. I love yoga, and if anyone's ever practiced yoga, it's a terrific way to get the most out of the posture you have available. Practicing yoga is a lot different now than it used to be. It's certainly much more mainstream. It doesn't have to be a Zen meditative kind of process. It can be much more fun and physical. And most people who are conditioning their body somehow a little bit every day, they're incorporating some kind of yoga, and they get a lot of benefits from it. So yoga can be a little intimidating, especially for guys, I think. Going into a yoga studio and seeing a teacher if you've never seen one before, but go buy some cheap DVDs on Amazon and do them for 6 or 7 months in your living room, and then give you an idea about what the postures are called. And then once you get into a class, you'll know what up dog and down dog and warriors poses all mean. But the patients, again, the patients that I have who do yoga on a regular basis, they get more benefit out of the joints that are there. Just like any exercise, you got to make sure you do it the safe way. So make sure you take your time and really learn how to do the postures. There's another form of movements called foundation training. And if anyone has some spinal issues, particularly lower back issues, I encourage you to go to foundationtraining.com. A chiropractor developed a sequence of movements for particularly the lower back. And it looks like a hybrid of yoga, Pilates kind of movements. And when you watch them do it, you're like, well, that can't be that hard. And then once you start to do it, it's really hard, particularly if you had some low back issues. But what foundation training does is it helps stabilize the lower back by really incorporating some healthier movements through the pelvis and the lower back. And I've recommended it to some patients, and I know that it has helped keep them out of surgery. So if you've struggled with chronic lower back issues, and you know someone who's struggled with chronic lower back issues, I would recommend that they talk to their chiropractor, start some foundation training. It's pretty easy to start. You don't need any equipment. You just need an open space on a floor and access to the internet. The best way to do that, you check out foundationtraining.com, but then go to YouTube and look for foundation training. If you just search foundation training, you'll come up with a YouTube video. It's a 13-minute video just on the lower back. And someone can try that video on YouTube for free. Do it every day or every other day for a few weeks. See if they start to get some benefit from it. If that's helping you, then go to the website and buy his DVD. It's like $40 for his DVD. He's got the whole sequence of movements in there. And that's a better way of kind of testing if foundation training is a good option for you, though. Doesn't matter how old you are or what you have going on. If you can do these kind of exercises that they do in foundation training, it's really, really helpful. If you have questions on that, shoot me an email. Let me know. I'll send you those links. I'd be happy to point you in the right direction and make sure you're looking at the right stuff. Other exercises, we talked about traction, yoga. Weight training is, particularly for females, super important. Making sure that you're bearing some kind of heavy weight on a regular basis in a safe way. Doing things like assisted lunges or assisted squats. Finding some way to challenge your joints within their normal range of motion. People have to do that. It got a bad rap for a while, but more and more the people who find a good trainer, talk to someone like Martha, who can get you into the right kind of exercises on a regular basis. You don't have to hit the weights every day, but a couple days a week of some weight training mixed in with 1 day of yoga, a couple days of cardio on a bike or a treadmill or whatever you like to do to get your heart rate up. That's a great cross-training regimen right there. And you don't have to do it for more than 30 to 45 minutes a day. If you're training the right way, you can really make a benefit on the health of the spine. That's all I had in terms of the more active what things you can be doing. I want to save time for you guys, because I know you have stuff to talk about. But any questions? Walking or biking? That's great. Walking in particular, try to find some little hillier spots, or if you're on a treadmill, make sure you're changing the pitch a little bit to give your body a little different look. Walking's great. I love biking too, particularly if you have always been a walker or a runner. To throw in a little biking once a week is a great way to cross-train, because you're going to be using muscles that you haven't used before. Yeah. Mm-hmm. Probably. Can I ask exactly where the injury is? Is it low back? Is it mid back? Okay. Okay. Was there a disc issue? Might I ask? Bulging disc? Okay. So if you have a bulge disc, and let's clarify what that means. So the intervertebral disc is the space between the bones. Those are the shock absorbers. The disc is shaped like a jelly donut, essentially, if you want a good analogy. You've got the fibrous outside portion, and then there's a jelly on the inside. That jelly and the fibers are supposed to withstand up and down weight, and they do a really good job with that. What they don't do a good job of is the twisting, torsion kind of things. So a tiny little portion of the back part of the disc might be torn, and then what happens is just the pressure there bulges that disc backwards. And the reason that's important is because what's behind the disc but the nerves that lead the spine. If you have a bulge, you'll always have a bulge, and there's no way to get around it. And the quickest way to flare up a bulge disc is to bend kind of directly at the waist and twist to one side and do like a pulling movement. So that is shoveling, that is raking, picking up, a gym bag without thinking. So first and foremost, you kind of hinted towards it, you have to be really intentional in thinking about your movements if you're doing it. So any of those activities, you want to make sure you're warmed up and using your legs and never using the spine to make that movement, because that's going to zero in on that. So other things to help with it, you want to make sure that the vertebra above and below that disc move the right way. Foundation training is really good for that. Okay, and I would encourage you to check out that YouTube and the website just to try it. It seems like you're relatively active enough. You could spend 15 minutes every other day doing that for a week or two and see if you notice a difference. Certainly make sure you get adjusted periodically to make sure these vertebrae move in the right way. Some home traction can help as well. And then I would look at the foundation stuff. Yeah. But that disc is always going to be there. So that's kind of be your weakest link, And a lot of people have that, whether it's the low back or they've got an old whiplash in the neck. If something's going to go out, it's going to be that. You just got to protect it and be super intentional with your movements. And that's why foundation training is good, because it kind of teaches you how to move a little differently to protect that part of the body. Yeah, if you've ever seen in yoga, they call it the chair pose or fierce pose. Your legs are together, kind of bending your butt back and your arms are up here. The foundation training starts with a posture that's similar to that, where it's firing up the hip stabilizers and the pelvic stabilizers. And then it works on some of the less abdominal core muscles. Too many people think of core and they think, I got to get my abs tight. Well, that's only like a small portion of the core. You've got to focus a lot on hip stability, pelvic firing, and then some of the lumbar paraspinals. So that's what the foundation training does. It focuses on elongation and stabilization kind of at once, which is another reason why good yoga is important too, because that's what a lot of yoga postures do as well. Foundation is more specific just for the spine. That's why it's pretty helpful. Okay, great. Thanks. Yeah, thanks for your time. Yeah, thanks for your attention. Yeah.